My name is Tushar Patel. I'm a pediatrician here in Fresno. I'm co-owner of Children's Medical Centers of Fresno. So over the years, the way we utilize our remote team has evolved. More and more tasks have been added to do list. What started off as an immunization card getting scanned in the front for new patients that came in and transcribing that immunization card into the immunization module, so that way now we had a real-time information as to, is this child up to date or is this child behind on shots? So we could leverage the immunization module within IMS. That's what the task started off as. And then it slowly evolved into taking care of the hundreds of faxes that come in to all 4 locations, triaging the faxes, differentiating them between faxes for clinicians, medication refills, hospital discharges, newborn discharges, premature baby discharges, legal documents, and coming up with a flow chart that if a legal document were to be coming in and if it was time sensitive, not only would it be forwarded to my inbox, but I would get an email or even a phone call notifying me that this form needs to be addressed sooner than later. We went ahead and leveraged the remote team to then go ahead and make appointments for patients that were discharged from the ER or from the newborn nursery, and make appointments for them so that way, they weren't falling through the cracks. We wanted to make sure that the continuity of care was there for these patients. Apart from managing the discharge or the hospital aspect of the practice, it was just as important that patients that were seen in the practice and for whom referrals were made, that they were getting seen in a timely fashion as well. And we kind of know that the ball usually drops in our own office or it drops at the referring office. And we made sure with this flow that referrals had to be completed and sent to the referring physician within 24 hours. That means the remote team, once a referral request was made in the EMR, would go ahead and populate the appropriate documents, have the document ready, have that document sent into my task folder so that it was ready to be signed off by me, and then they would make sure that that document was sent that same moment to whatever facility the patient was going to be going to be seen. Besides that, they followed up. If there wasn't a response from that facility, they would make phone calls and document within the referral tracking module that this office was contacted. Yes, they will now process the referral, and then they would follow up once more to confirm that an appointment has been made and the patient was notified. So this serves 2 purposes. Number 1, we've done our due diligence and made sure that the patient is getting referred in an appropriate time. Secondly, if there was a question regarding where the referral stood, we would be able to document to the patient that these are all the notes or steps that we took to make sure that this referral was processed properly. Besides the referrals, we also have our remote team monitor the inboxes or the tasks for all of our clinicians. If we see that by the end of the day they have charts that need to be signed, referrals that need to be signed, medication refills that need to be signed, they are called and emailed as a reminder that please finish up these tasks before you leave for the end of the day. So I think this is really important. That way somebody is policing what we're doing, because in our busy and hectic schedules, we forget to do some of the most basic and fundamental things as clinicians. So that was, I feel, is really, really important. Another aspect that they help us out with is we have a pretty big refrigerators and freezers for immunizations. We have cellular connections that basically tell us if there are any temperature excursions with the thermometers that we have. Whenever there is a temperature excursion, the remote team is notified and they make sure that we've addressed the issue in question in a timely manner. So that's really, really important. Another thing that the remote team helps us with is data mining. They take in a lot of time and try to customize and generate reports that are very, very important for the being of our practice. What does that mean? Hey, how many patients who had a low hemoglobin have not come in? Let's get those patient numbers, let's call them, let's notify them and make appointments for them. So this can be for hearing tests, failed hearing tests, abnormal urine results, abnormal lead results. So there's a multitude of ways you can leverage the remote team and utilize the reports that are within IMS to call patients in. So we've had a relationship with Dr. Catalyst and their remote team for several years. The word remote doesn't really exist for us, maybe in the beginning. For us, it's our local team. Just as we have teams in our 3 other locations, the remote team is one of those locations for us at this juncture. Well, I think the most obvious answer was finances, because it felt like it was going to be a lot cheaper than having multiple employees go through the payroll system here in Fresno. But what we found out was, yes, money is important, but reliability, consistency, and kind of like following the company policies and procedures, which we didn't expect, was amazing. We feel that the staff in the Philippines is like maybe the staff in my office that are on Fresno Street or on Abbey. We never ever feel that they're in a different country or a different location. We feel like they're part of this family here in Fresno. And it's taken time for us to develop that relationship, but even my staff feel the same way. We don't, say that we're going to be calling the remote team. We basically say, oh, I'm going to give, XYZ a call. And that's from all these years of basically holding each other's hand, walking through the ups and downs, because it is initially difficult when you're trying to form a team and have them work the way you want them to work with people that you see one-on-one. But with time, it feels like we've been through that one-on-one process, and it's been an amazing asset for our team, because in the Philippines, whenever someone calls in sick, they're automatically replaced with a backup. We don't even skip a beat. We don't even know that we have someone that's called in sick. And I feel that's one of the great pluses of having a team over there. The other one is that the individuals that are in the remote team are amazingly soft-spoken. They're very congenial. And we've heard a lot of compliments from our patients that they are some of the most politest people that they've interacted with on the phone. And for me, that's an asset, because at the end of the day, I want patient satisfaction. I want my patients to be happy. And if this makes them happy, then I've achieved more than what I ever wanted with my Philippines team. And we're super proud that we have a team that is part of Dr. Catalyst, but that is also my CMC Fresno team.